Good afternoon. My name is Kate Sherry, and I'm one of the co-founders of Therastat. This is the family of Sonwabo, a 16-year-old boy who lost the use of his legs about 2 years ago due to TB in his spine. Sonwabo and his family live in a remote valley in rural South Africa, where access is only on foot and the nearest public transport is more than 6 kilometers away. When the disease began, Sonwabo's family managed to get him to their local clinic, where the nurse referred him on to the hospital where he could see a doctor. This would mean a long and expensive day's travel, and by the time the family were able to take him, it was too late. Sonwabo could no longer walk, and the damage to his spine was permanent. On the day Sonwabo was seen at the hospital, he was also referred to us, the rehabilitation team. We gave him the wheelchair and an appointment to come back for further therapy. Again, Sonwabo's parents couldn't afford the return visit, so he remained at home, the family doing their best to care for him, but not really knowing what to do. He couldn't leave the house without being carried, and he also developed incontinence as the damage to his spine progressed. 6 months later, he did come back to hospital, but this time with a severe pressure sore. For us, Sonwabo's situation summed up our biggest challenge as rehab workers in this setting. The very reasons Sonwabo needed us were the exact same things that prevented him from coming: disability, remoteness, and poverty. And we know that Sonwabo is not alone. It was clear that we needed to reach people like Sonwabo in their own homes, but where even to start? What we needed was a way of knowing who's out there, where are they, what do they need, and when do they need it. Therastat was part of our solution. Therastat is a web-based app on which we register all our rehab clients, together with the details of where they live, what they need, and what services they've already received. The app uses that data to create schedules for us, telling us where to go and whom to see. And when we get there, Therastat puts the client's record at our fingertips, making it easy to ensure we do everything that's needed on the spot. We're no longer waiting for a crisis like Sonwabo's pressure sore brings people to us. We're out there making sure those crises don't happen. We built Therastat using a no-code software platform and have been using it in our own service for more than 2 years. We serve a rural district of about 100,000 people, and so far we've logged 12,000 rehab clients, of whom about 460 are like Sonwabo, high need but hard to reach. In that time, we've completed more than 2,500 home visits, and we've issued more than 500 wheelchairs. And although rehab workers aren't the most enthusiastic about tech, more than 30 staff have learned to use Therastat successfully. The number of people needing rehabilitation globally is growing rapidly, and the need is greatest in low-resource settings like ours, where the majority of people with disabilities live. Agencies like the WHO and the UN are building demand through campaigns such as Rehab 2030 and AT 2030, and we believe Therastat could be a powerful tool in this cause. Our next goal is to put Therastat in the hands of 3 more rehab teams in our own country and 2 elsewhere in Africa. This would take the app's coverage to more than 500,000 people and put up to 2,000 more Sonwabos on the map for their local rehab providers. In order to do this, our team needs to expand its technical expertise. Both of the co-founders of Therastat are rural rehab professionals with more than 20 years' experience each working in remote communities. We're well networked in the local and international rehab and disability sectors, and we have additional experience in policy, advocacy, and research in our field. But to ready Therastat for scaling, we need digital health systems experts who can take it from a no-code, user-maintained product to a platform that can handle much larger amounts of data and is compliant with data protection legislation in the regions where it will be used. Our next step is to develop a costed strategy for this build. Right now, we're looking for around $30,000 to bring in the IT and legal expertise to create that and to complete product development on the scalable MVP. This phase should take approximately 6 months, at the end of which we will have a plan and partners in place and be ready to pitch for further investment. What matters here is not the big numbers, it's the difference that the right rehab services can make to people like Sonwabo and his family. Since we've been able to work with them at home, Sonwabo has gone from being housebound and isolated to returning to school, to being with his friends again. Handling a wheelchair here is still difficult, but he needs less physical help from his family, which frees them up to look after their crops and their livestock and to take part in community activities again. Life has changed for the whole family, and as others in this community see Sonwabo living his life as a wheelchair user, more people with disabilities are coming forward to seek our services too. This is the difference we want to make, and this is the reason for Therastats. Thank you.